Greetings, my friends. This is Dr. Jaime Daniel, and welcome to my show. Today, I want to share with you an overview of osteopetrosis. Osteopetrosis is a rare disorder that causes bones to grow abnormally and become overly dense. When bones become overly dense, they are brittle and can fracture easily. In addition, bones may be misshapen and large, causing other problems in the body. For example, changes to the bone size and density of the skull that can cause pressure on nerves, leading to the vision loss, hearing loss, and paralysis of the facial muscles. As the bone increases in size, the amount of space for the bone marrow becomes crowded. Decreases in the amount of space for bone marrow can lead to low levels of cells in the body that fight infection, carry oxygen to the body cells, or control bleeding. Osteopetrosis is a genetic disease that a child inherits from their parents. The disorder may be mild to severe, and symptoms may appear early in infancy and later in adulthood. The treatment and options depend on the type of osteopetrosis the person has. People with a family history of the disease are at greater risk of inheriting it through an abnormal gene that is passed on from one or both parents. The types of osteopetrosis are broken into categories based on inheritance pattern, age the disease develops, and the severity of the disease. Some of these types include Autosomal recessive osteopetrosis, which is the severe infantile form of the disorder. The symptoms of this type develop at or shortly after birth and shorter life expectancy. Autosomal dominant osteopetrosis is the non-infantile form of the disorder and is also known as Albers-Schomburg disease. The symptoms of this type develop later than the infantile form and have a wide range of disease severity. Even within the same family, some people have little or no impact from the disease, while others are severely affected by the disease and have significant disability and shortened life expectancy. People with this type of osteopetrosis may not be diagnosed until adolescence or adulthood. X-linked osteopetrosis is a rare form of the disease and can affect many areas of the body. The severity of symptoms can vary depending on the type of osteopetrosis, like bone fractures from brittle, dense bones, nasal congestion from narrowing sinus cavities, vision and hearing changes from enlarged bones pressing on nerves, dental problems due to bone changes in the skull and jaw, and because teeth come in later than normal. Low blood cell levels due to smaller amount of bone marrow because a crowding in the center of bones can lead to anemia and infection. Infections in the bones, known as osteomyelitis, also chronic bone pain. Osteopetrosis is a genetic disease that, in most cases, a child inherits from one or both parents. Genes carry information that determines which features are passed to you from your parents. We have two copies of most of our genes, one from each parent. People with osteopetrosis have a gene that causes the body to make too few or abnormal cells called osteoclasts. When the osteoclasts are missing, old bone is not broken down and new bone is made, leading to dense, weak bones. The inheritance pattern helps determine the type of osteopetrosis in the person that it has. For example, autosomal recessive inheritance pattern happens when the parents each carry one copy of the mutated gene but do not show any signs or symptoms of the disease. It's important to note that the mutated gene may not be passed from both parents to every child. Some children will not have any copies of the gene, and others may only have one copy, making them carrier. Also, we have the autosomal dominant inheritance pattern happens when only one mutated copy of the gene appears. This happens when the child inherits one copy of a mutated gene from one parent. However, sometimes the mutated gene appears with no family history. And last, the X-linked inheritance pattern. It causes a rare form of the disease and happens when a mutation occurs in genes on the X chromosome, one of the two sex chromosomes in each cell. This type of osteopetrosis usually affects boys. The diagnosis of osteopetrosis usually involves things like taking a family and medical history, performing an exam, ordering some laboratory tests and imaging studies. Also, you might be requested to get some X-rays to evaluate bone structures, including dense and misshapen bones, genetic testing to help determine the specific cause and type of osteopetrosis. In the blood tests, you have to be checked about blood cell counts, also vitamins and minerals levels, and some certain hormones levels. A computerized axial tomography scan and magnetic resonance imaging to evaluate changes in the bone marrow, space, and sculpt may be useful. About the treatment of osteopetrosis, the first and most important is knowing the type of osteopetrosis, and it helps your doctor to treat the symptoms and problems from the disease. Genetic testing also allows your doctor to examine specific changes in the genes, so treatment can be tailored depending on the cause and expected severity of the disease. You may receive some special medication, also corticosteroids. Physical and occupational therapy can help children develop motor and other skills. Bone care may include casts, splints, or surgery to correct fractures and misshapen bones. Bone marrow transplant may be recommended for infants with the severe form of the disease and for people with bone marrow failure. Your doctor will recommend this type of treatment on a case-by-case basis after reviewing the risks and benefits. Bone marrow transplant can cure the disease for certain people, but it cannot reverse damage that has already occurred. Regular visits with the doctor are important to check symptoms and laboratory testing results and to discuss the potential of the treatment. Living with osteopetrosis is different for each person. Some people have few or no symptoms. while others have many symptoms that affect their ability to perform daily activities. For example, see your healthcare providers on a regular basis. Talk to your doctor or physical therapist about which types of exercises are best for you based on the type of osteopetrosis you have. Also ask your doctor about nutrition. Keep the lines of communication open. Ask family and friends for help when you need it. Reach out to online and community support groups. Well, I hope you enjoyed this episode and we will see you in the next one. Thank you.